Hello everyone, welcome to OnyekaGOD-TV, your trusted source for all things skin health. I'm Dr. Amara Okafor, and together with OnyekaGOD-TV, we'll explore the secrets to clear skin. Today we're going to talk all about acne. So many people experience acne at some point in their lives. It is a very common skin condition. It shows up as different kinds of bumps on your skin. These bumps can be small, or they can be large and painful. Acne often appears on the face, but it can also be on your neck, chest, back, and shoulders. It is nothing to be ashamed of. We are here to understand it better together. What really causes these pesky spots to appear on our skin? Well, it usually starts deep inside tiny holes in your skin called pores. Your pores have oil glands in them. These glands produce an oily substance called sebum. Sebum is actually good for your skin in small amounts. It helps keep your skin moisturized and protected. However, sometimes these glands can produce too much sebum. This extra oil can then mix with dead skin cells that haven't shed properly from the skin's surface. This mixture can create a sticky plug. This plug can then block the pore, leading to problems. Once a pore gets clogged with oil and dead skin cells, it creates the perfect environment for bacteria to grow. There is a specific type of bacteria that loves to live on our skin called Propionibacterium acnes, or P. acnes for short. When these bacteria get trapped inside a clogged pore, they can multiply very quickly. This growth of bacteria can cause irritation and inflammation. Inflammation is your body's natural response to injury or infection. It is what makes pimples look red, swollen, and sometimes feel sore or tender to the touch. So it's a combination of oil, dead skin cells, and bacteria working together. So who gets acne? The truth is, almost everyone can get acne. It is most common during the teenage years. This is because of hormonal changes that happen during puberty. These hormones can make oil glands produce much more sebum. But adults get acne too. Many men and women deal with breakouts well into their 20s, 30s, 40s, and even beyond. Adult acne can be caused by hormones, stress, certain medications, or even some skincare products. It is important to remember that you are not alone if you have acne. Millions of people understand what you are going through every single day. And here at OnyekaGOD-TV, we're here to help you on your journey to clearer skin. Now that we know what acne is, let's talk about the different types of pimples. Not all pimples look the same, and they don't all behave the same way either. Understanding the type of acne you have can help you choose the best way to treat it. We can broadly divide acne into two main groups. There is non-inflammatory acne, which includes whiteheads and blackheads. Then there is inflammatory acne, which includes papules, pustules, nodules, and cysts. Inflammatory types are usually redder and more sore. Let's look at each one a little closer so you can become a pimple detective. First up are whiteheads and blackheads. These are also known by their medical names, closed comedones and open comedones. A whitehead or closed comedone happens when a pore gets completely clogged with oil and dead skin cells. The top of the pore is closed off so it looks like a small white or flesh-colored bump under the skin. A blackhead or open comedone is also a clogged pore. But with a blackhead, the top of the pore remains open to the air. The trapped oil and skin cells get oxidized by the air, which turns the contents dark, making it look black. It's not dirt. Next, we have papules and pustules. These are types of inflammatory acne, meaning they are red and swollen. A papule is a small, red, tender bump on the skin. These happen when the wall of a hair follicle breaks due to inflammation. There is no visible pus at the tip of a papule. A pustule is what many people typically call a pimple. It's similar to a papule, but it has a white or yellow center filled with pus. Pus is a collection of dead white blood cells, bacteria, and sebum. It's tempting to squeeze these, but be careful, as that can often make things worse. Finally, there are the more severe types of acne nodules and cysts. These are larger, deeper, and can be quite painful. A nodule is a large, solid, painful lump that forms deep within the skin. They develop when a clogged pore causes significant inflammation deep down. Cysts are large, soft, pus-filled lumps under the skin's surface. They are also very painful and can feel like a fluid-filled sac. Both nodules and cysts can last for weeks or even months. They also have a higher risk of causing permanent scarring. If you have these types, it's really important to see a dermatologist for help. Preventing pimples is often about creating good daily habits for your skin. Small changes in your routine can make a big difference over time. One of the most important habits is proper skin cleansing. You should wash your face twice a day, once in the morning and once before bed. It is also a good idea to wash after you have been sweating a lot, like after exercise. Use a gentle cleanser that is right for your skin type. Avoid harsh scrubs or rubbing too hard, as this can irritate your skin and actually make acne worse. Pat your skin dry gently with a clean towel. What you eat and drink can also play a role in your skin's health. While food alone doesn't usually cause acne for most people, a balanced diet is good for your whole body, including your skin. Drink plenty of water throughout the day to keep your skin hydrated from the inside out. Some people find that certain foods, like dairy products or sugary foods, might trigger their breakouts. It can be helpful to pay attention to your own body and see if any particular foods seem to make your acne flare up. Eating lots of fruits, vegetables, and whole grains supports overall skin wellness. Stress is another factor that can contribute to acne breakouts. When you are stressed, your body produces more of certain hormones like cortisol. These hormones can tell your oil glands to produce more oil, which can lead to more clogged pores and pimples. Finding healthy ways to manage stress is important for your skin and your overall well-being. Try activities like exercise, meditation, yoga, or spending time on hobbies you enjoy. Even taking a few deep breaths throughout the day can help reduce stress levels. Getting enough sleep is also crucial for managing stress and letting your skin repair itself. There are a few other simple habits that can help keep your skin clearer. Try to avoid touching your face throughout the day. Your hands can transfer oil, dirt, and bacteria to your skin, which can clog pores. Clean things that touch your face regularly, like your phone screen and your pillowcases. Pillowcases can collect oil, dead skin cells, and bacteria, so change them every few days. And please, resist the urge to pick or squeeze your pimples. This can push bacteria deeper into the skin, cause more inflammation, and lead to scarring. It's a tough habit to break, but so important. If you are dealing with mild to moderate acne, there are many effective treatments you can find right at your local drugstore. These are called over-the-counter or OTC treatments. They don't require a prescription from a doctor. These products come in various forms like cleansers, lotions, gels, creams, and spot treatments. The key is to find ingredients that work for your skin type and to use them consistently. It is always a good idea to start with one new product at a time. This way, if your skin reacts, you will know which product caused it. Remember, patience is important with these treatments too. One of the most common and effective OTC ingredients for acne is benzoyl peroxide. This ingredient works in a few ways. First, it helps to kill the P. acnes bacteria that contribute to pimples. Second, it can help to remove excess oil and dead skin cells from the pores. Benzoyl peroxide comes in different strengths, usually from 2.5% up to 10%. It is often best to start with a lower strength to see how your skin tolerates it, as it can sometimes cause dryness or redness. You can find it in washes, creams, and gels. Another popular OTC ingredient is salicylic acid. Salicylic acid is a beta-hydroxy acid, or BHA. It works by gently exfoliating the skin and helping to dissolve the gunk that clogs pores. It can get deep into the pores to clear out oil and dead skin cells. This makes it particularly good for treating blackheads and whiteheads. Salicylic acid is usually found in cleansers, toners, and spot treatments. Like benzoyl peroxide, it can sometimes cause dryness, so start slowly and always use a moisturizer. Some products combine salicylic acid with other gentle ingredients to help soothe the skin. When using any OTC acne treatment, it is important to use it correctly and safely. Always read the instructions on the product label. It is a good idea to do a patch test on a small area of skin before applying it to your whole face. This helps check for any allergic reactions or excessive irritation. Start by using the product every other day, then gradually increase to daily use as your skin gets used to it. Don't overuse these products. Thinking more is better, as this can lead to severe dryness and irritation. And always follow up with a gentle, non-comedogenic moisturizer, even if your skin feels oily. Alongside drugstore treatments, some people find that gentle, natural home remedies can help soothe their skin or, complement their acne care routine. It is important to remember that these remedies are not usually a cure for acne on their own, especially for more severe cases. However, they can offer some relief for mild breakouts or help calm inflammation. Always be cautious and honestly, listen to your skin. Just because something is natural does not mean it cannot cause irritation. A patch test is still a very good idea before applying anything new all over your face. Tea tree oil is a popular natural remedy for acne. It comes from the leaves of the tea tree, which is native to Australia. Tea tree oil has natural antibacterial and anti-inflammatory properties. This means it can help reduce the P. acnes bacteria on the skin and calm down redness and swelling. However, tea tree oil is very potent and should never be applied directly to the skin undiluted. It must be diluted with a carrier oil like coconut oil or jojoba oil before use. A common dilution is 1 to 2 drops of tea tree oil per teaspoon of carrier oil. Apply sparingly to affected areas. Aloe vera is another wonderful natural ingredient known for its soothing and healing properties. The gel from the aloe vera plant is rich in vitamins, minerals, and antioxidants. It can help to calm inflammation, reduce redness, and promote skin healing. Many people find it very soothing for irritated, acne-prone skin. You can use pure aloe vera gel directly from the plant or buy 100% pure aloe vera gel from a store. Apply a thin layer to clean skin. It can also help to moisturize the skin without clogging pores, which is great if other acne treatments are causing dryness. You can also try simple at-home masks using gentle ingredients from your kitchen. For example, a honey mask can be beneficial. Raw honey, especially Manuka honey, has antibacterial and anti-inflammatory properties. It can also be very moisturizing. Simply apply a thin layer of raw honey to your face, leave it on for 10 to 15 minutes, and then rinse off with warm water. An oatmeal mask can also be soothing. Mix plain, unflavored oatmeal with a little water to form a paste, apply it to your skin, let it dry, and then gently rinse. Remember, these are gentle options, not miracle cures. If irritation occurs, stop using them immediately. While over-the-counter products and home remedies can help many people with mild acne, sometimes they are just not enough. It is important to know when it is time to see a doctor or a dermatologist for your acne. If your acne is persistent and does not improve after several weeks of using over-the-counter treatments, it is a good idea to seek professional help. You should also see a doctor if your acne is severe, meaning you have many inflamed pimples, nodules, or cysts. If your acne is causing scarring or if it is significantly affecting your self-esteem or mental health, please make an appointment. A dermatologist can offer a range of prescription medications that are stronger and more targeted than over-the-counter options. These often include topical treatments, which are creams, gels, or lotions that you apply directly to your skin. Topical retinoids are a very common and effective prescription. These are derived from vitamin A and work by increasing skin cell turnover and preventing pores from becoming clogged. Examples include tretinoin, adapalene, which is also available over the counter in a lower strength, and tazarotene. Topical antibiotics may also be prescribed to help kill bacteria and reduce inflammation. Sometimes combination products are used. For more moderate to severe acne or acne that does not respond well to topical treatments alone, your doctor might suggest oral medications. Oral antibiotics such as doxycycline or minocycline can be very effective at reducing bacteria and inflammation from the inside out. These are usually prescribed for a limited period to avoid antibiotic resistance. For some women, hormonal therapies like certain types of birth control pills or spironolactone can help control acne that is linked to hormonal fluctuations. These medications work by regulating hormones that can increase oil production in the skin. In cases of very severe, persistent, or scarring acne, a dermatologist might discuss a medication called isotretinoin. This is a powerful oral retinoid that is very effective at treating severe nodular or cystic acne. It works by shrinking oil glands, reducing oil production, preventing clogged pores, and decreasing inflammation. However, isotretinoin has significant potential side effects and requires close monitoring by a dermatologist, including regular blood tests and, for female patients, strict pregnancy prevention measures. Your doctor will discuss all the benefits and risks with you to decide if it is the right choice. Beyond prescription medications, dermatologists have several advanced in-office treatments that can help manage stubborn acne or improve the appearance of acne scars. These procedures are performed by trained professionals and can offer significant improvements, especially when combined with a good home care routine. These treatments often work by targeting different aspects of acne formation or its after effects. Your dermatologist can help you decide if any of these advanced options are suitable for your specific skin concerns and acne type. They can be a great boost to your skin journey. Chemical peels are one common in-office treatment. During a chemical peel, a solution is applied to the skin that causes it to exfoliate and eventually peel off. This process removes the outer layer of dead skin cells, helping to unclog pores, reduce oiliness, and improve skin texture. Peels can vary in strength, from superficial peels that cause mild flaking to deeper peels that require more downtime. Superficial peels often use ingredients like salicylic acid, glycolic acid, or lactic acid. They can help with mild acne, blackheads, whiteheads, and can even out skin tone over a series of treatments. Laser and light therapies are another category of advanced treatments. Different types of lasers and light devices can be used to target acne in various ways. Some light therapies, like blue light therapy, can help kill the P. acnes bacteria on the skin. Other lasers might work by shrinking the oil glands to reduce sebum production. There are also lasers specifically designed to improve the appearance of acne scars by stimulating collagen production and resurfacing the skin. These treatments usually require multiple sessions for best results, and your dermatologist will explain the specific type of laser or light therapy that might benefit you. Other in-office procedures include professional extractions and corticosteroid injections. If you have stubborn blackheads, whiteheads, or small pustules, a dermatologist or a trained esthetician can perform sterile extractions. This involves using special tools to safely remove the contents of clogged pores, which can help them heal faster and prevent them from becoming more inflamed. For very large, painful, and inflamed cysts or nodules, a dermatologist can sometimes inject a dilute corticosteroid solution directly into the blemish. This can help to quickly reduce inflammation, pain, and swelling, often within a day or two, and can also lower the risk of scarring from that specific lesion. Achieving clearer skin is often a journey, not an overnight miracle. It is so important to understand that there is no magic cure for acne. Whether you are using over-the-counter products, prescription medications, or even undergoing advanced dermatological treatments, results take time. Your skin needs time to respond to treatments and to heal. It can be frustrating when you don't see changes immediately, but try to be patient with yourself and with the process. Stick with your recommended routine and give it at least 4 to 8 weeks, sometimes longer, to see noticeable improvements. This journey requires commitment. Consistency is truly key when it comes to managing acne. Skipping days with your cleanser, moisturizer, or acne medication can slow down your progress. Think of it like exercising or learning a new skill. You need to do it regularly to see results. Establish a simple, manageable skincare routine that you can stick to every day, both morning and night. If your dermatologist has prescribed medication, use it exactly as directed. If you are unsure about any part of your routine, or if you are experiencing too much irritation, talk to your doctor. They can help you adjust your plan to make it work better for you. Beyond specific treatments, remember that good overall skin health habits are foundational. This includes gentle cleansing, appropriate moisturizing, yes, even oily skin needs moisturizer, protecting your skin from the sun, eating a balanced diet, managing stress, and getting enough sleep. These habits support your skin's natural ability to heal and stay healthy. It is also important to manage your expectations. While treatments can significantly improve acne, you might still get an occasional pimple. The goal is to manage the acne, reduce breakouts, and prevent scarring, leading to healthier skin overall. It's also vital to approach your skin with kindness and understanding. Acne can be emotionally challenging, but remember that your skin condition does not define you. Focus on the positive steps you are taking to care for your skin. Avoid comparing your skin to heavily filtered images you might see online. Everyone's skin journey is unique. Celebrate small victories along the way, like a reduction in redness or fewer new breakouts. Having a supportive network, whether it is family, friends, or a good dermatologist, can also make a big difference in how you navigate your path to clearer, healthier skin. There are so many myths and misconceptions floating around about acne. Let's clear up a few common ones so you have the facts. One big myth is that acne is purely a hygiene problem or that it is caused by having dirty skin. The truth is, acne is much more complex than that. While cleansing is important, overwashing or scrubbing too aggressively can actually irritate your skin and make acne worse. Acne is primarily caused by a combination of factors including excess oil production, clogged pores due to dead skin cells, bacteria, and inflammation, often influenced by hormones. So, it's not just about how clean your face is. Another very common myth is that squeezing or popping pimples is the best and quickest way to get rid of them. Oh, I know how tempting it can be, but trust me, popping pimples yourself usually does more harm than good. When you squeeze a pimple, you can accidentally push bacteria and pus deeper into the pore. This can make the inflammation worse, leading to a bigger, redder, and more painful pimple. It can also damage the surrounding skin tissue, which significantly increases your risk of developing permanent acne scars or dark spots. It is always best to let pimples heal on their own or seek professional help for extractions. Many people believe that getting a tan or using tanning beds will help clear up their acne. While sun exposure might seem to dry out pimples temporarily and make them less noticeable due to the tan, it is not a healthy or effective long-term solution. In fact, ultraviolet radiation from the sun or tanning beds damages your skin. This damage can lead to premature aging, an increased risk of skin cancer, and can even worsen acne in the long run for some people by causing more inflammation or clogging pores as the skin tries to protect itself. Always use a non-comedogenic sunscreen to protect your skin. Finally, there's the myth that you just have to wait for acne to go away on its own, especially if you are a teenager. While some mild acne might clear up with time, many forms of acne, particularly moderate to severe types, can persist for years if left untreated. Waiting it out can lead to unnecessary discomfort, emotional distress, and an increased risk of permanent scarring. The good news is that effective treatments are available. Whether it is over-the-counter products or help from a dermatologist, taking action can help manage your acne, prevent new breakouts, and improve the overall health and appearance of your skin. Don't hesitate to seek help.